Welcome to Angie E-lums, aka UROKRA'S SPACE. Do you know what to do if someone suddenly collapses in front of you? Picture this. You're out enjoying a lovely sunny day in the park. Children are laughing, dogs are chasing frisbees, and all seems right with the world. Then, out of the blue, a fellow parkgoer keels over. It's unexpected, it's shocking, and most importantly, it's a situation where knowing basic cardiopulmonary resuscitation, or CPR, could make all the difference. CPR, ladies and gentlemen, is not just a series of actions performed by professionals in medical dramas. It's a genuine life-saving procedure that can keep a person's heart and lungs functioning until medical help arrives. We're not just talking about buying time here, we're talking about saving lives. Now, I know what you're thinking. Me? Perform CPR? But I'm not a doctor. Well, here's the thing. You don't have to be. Anybody can learn CPR. It's a skill, like riding a bike or baking a souffle, and like any skill, it takes a bit of practice to get right. But once you've got it down, you carry with you the ability to step up in an emergency situation. Imagine being able to keep your cool and act effectively when someone's life hangs in the balance. It's not about being a hero, it's about being prepared. It's about knowing what to do when every second counts. CPR is a skill that, once learned, stays with you forever, ready to be used whenever it's needed. So whether you're a teenager, a grandparent, or anywhere in between, learning CPR is for you. It's for everyone. Because you never know when you might be the one person around who can make a difference. Now, I've talked enough about the why. It's time to move on to the how. So fasten your seatbelts and get ready for a crash course in CPR. Now let's jump right into the steps of CPR, shall we? Before you turn into a superhero, make sure the scene is safe. Indeed, safety is paramount. It's like the pre-flight safety instructions on an airplane. You must secure your own oxygen mask before helping others. In the same way, before rushing to aid someone who's collapsed, it's crucial that you first ensure your personal safety. You don't want to end up as a casualty yourself, adding to the chaos. So you might ask, what does ensuring safety entail? Well, it starts with a quick scan of the surroundings. Look out for potential hazards such as traffic, fire, or any other dangers that could pose a risk. If the situation seems unsafe, don't be a daredevil. Wait for professional help to arrive. Now, once you've established that the scene is safe, it's time to check the person's responsiveness. This is not the time to be shy. You're not waking them up from a nap after all. Approach them and ask loudly, "Are you okay?" Give them a gentle shake, but avoid moving them unnecessarily. Why do we do this, you might wonder? Well, this is to ascertain if the person is truly unconscious or merely sleeping off a heavy lunch. It's also a way to check if the person can respond or move on their own. If they respond, great, you can breathe a sigh of relief. But if they don't panic. Remember, you are the superhero here. Your calm and composed actions can make a world of difference to someone's life. So if there's no response, it's time to take the next step. Don't fret about the what-ifs and the maybes. Instead, focus on what you can do. And that is to call for help. Because when it comes to life and death situations, every second counts. So remember, before you leap into action, take a moment to assess the situation. Maintain your safety, check for responsiveness, and if needed, call for help. If there's no response, it's time to call for help. Don't forget the magic number, 999 if you are in the UK, 911 for US, Canada, and some other countries. Please check to know the country specific for where you are. When you're faced with an unexpected collapse, every second counts. It's crucial to dial 999 immediately, even as you're assessing the situation. You see, emergency services are your lifeline. They're the professionals who can guide you through this tense moment and get the necessary help on its way. When you dial 999, you're not just calling for an ambulance, you're calling for an ally. So how do you communicate effectively with the operator? Well, it's about being clear, concise, and calm. Describe the situation as accurately as you can. Is the person conscious or unconscious? Breathing or not breathing? Any other symptoms? Remember, the operator is there to help, not to judge. The more precise your description, the better they can assist. And just like that, you've taken the first vital step. With help on the way, you're ready to start CPR. Now it's time to pump it up. Let's dive right into the heart of CPR. Chest compressions. This is where your hands transform into a human version of a heart pump. Sounds a bit like a superhero power, doesn't it? But remember, with great power comes great responsibility. Firstly, let's talk about the position of your hands. Finding the right spot is key. You need to place the heel of one hand in the center of the person's chest, right between the nipples. Then, place your other hand on top of the first, interlocking your fingers. This double-handed approach gives you the strength you need to compress the chest. It's a bit like preparing for a push-up, only this time the stakes are slightly higher. Now, let's talk about the depth of compression. You're aiming to press down hard and fast to a depth of about 2 inches or 5 centimeters. That's about the length of a credit card or a digestive biscuit if you're feeling peckish. But remember, we're saving lives here, not playing a game of snap. The rate of compressions is equally important. You should aim for a tempo of 100 to 120 compressions per minute. If you're struggling to keep the rhythm, try humming the Bee Gees' hit Stayin' Alive in your head. Yes, it's ironic, but it's also a perfect musical metronome for chest compressions. Now, it's crucial to let the chest rise back up completely after each compression. Think of it as a heart pump. Each compression is like squeezing water out of a sponge, and letting the chest rise is like allowing the sponge to fill back up. It's also important to note that during chest compressions, you're not just blindly pushing down. You're trying to circulate oxygen-rich blood to the brain and other vital organs. So, think of each compression as a life-giving push, not just a physical exercise. But what if you get tired? It's a valid question. Chest compressions can be tiring. If you have someone else with you, you can take turns, swapping every 2 minutes, like tag team wrestlers. If you're alone, take a short break if you must, but remember, every second counts. Lastly, don't worry about breaking ribs. It can happen, and it's far better than the alternative. The person you're helping will thank you later. After all, a broken rib can heal, but a life cannot be replaced. In summary, chest compressions are all about the right hand position, the correct depth, and the right tempo. It's a bit like dancing, only this dance could save a life. So practice, practice, practice. Remember, you're not kneading dough, but saving a life. Breath of life, not a romantic kiss. That's our motto when it comes to giving rescue breaths in CPR. It's not about passion or a spark, it's about potentially saving a life. When someone's heart stops, their lungs stop too. That means they're not getting the oxygen they need. Rescue breaths are our way of stepping in and helping out. Think of it as being a temporary lung for someone in need. Now, before we dive in, keep in mind that rescue breaths are only part of the CPR process. They're sandwiched between rounds of chest compressions. So after you've given 30 chest compressions, it's time to give 2 rescue breaths. First, you'll need to open the airway. To do this, place one hand on the person's forehead and gently tilt their head back. With your other hand, lift the chin forward. This head tilt, chin lift maneuver is a nifty trick that helps clear the airway, making it easier for air to flow into the lungs. Next, you'll need to check if the person is breathing. Get close and look, listen and feel for breaths. If they are not breathing or only gasping, it's time to step in with rescue breaths. Now here's where it gets a bit personal. You're going to need to pinch the person's nose shut. Yes, you heard that right. Pinch the nose shut. This is to ensure that the air you're breathing into them doesn't escape through the nose. Then take a normal breath and cover the person's mouth with yours, making sure you're creating a complete seal. Breathe out, as if you're blowing up a balloon. This should make the chest rise visibly. If the chest doesn't rise, reposition the head and try again. Sometimes it just takes a bit of tweaking to get it right. Remember, it's not a time for panic, but a time for patience and persistence. After giving the first breath, give them a second one right away. Just like the first, it should be enough to make the chest rise. And there you have it. That's the process of giving rescue breaths. It might feel a bit strange or even intimidating at first, but with practice, it will become second nature. Remember, these breaths are so much more than air. They're a chance at life. They're a beacon of hope in a difficult situation. They're an act of kindness that could mean the difference between life and death. So, don't shy away from giving rescue breaths. Embrace them, practice them, and when the time comes, use them. And just like that, you've given them a breath of fresh air. Now rinse and repeat. That's our motto. We're not talking about a shampoo bottle here, but a life-saving procedure. Let's dive right back into the cycle of CPR. So you've given your 30 chest compressions and 2 rescue breaths. Well done you, but don't go patting yourself on the back just yet. This isn't a one-and-done deal. CPR is a cycle, a rhythm, a dance of life, if you will. You have to keep going. The cycle of 30 chest compressions followed by 2 rescue breaths is not an arbitrary number someone pulled out of a hat. It's based on research and science. It's the sweet spot that keeps oxygen flowing to the brain and keeps the heart in a state where it could start beating again on its own. It's a balance between giving enough compressions to keep blood flowing but also allowing for those vital moments of oxygen intake with the rescue breaths. Now, you might be thinking, but I'm tired. I've been doing this for a while. I hear you. It's tough work saving a life. But remember, every compression, every breath could be the one that makes the difference. You are the bridge between life and what comes next. The importance of continuing CPR until help arrives cannot be overstated. You're like the drummer in a band, keeping the beat going until the ambulance crew, the lead singers, can take over. You're vital, you're important, you're a lifesaver. And here's a little secret. You don't have to be a superhero with bulging muscles to do effective CPR. It's about technique and persistence, not brute strength. So even if you're feeling a little winded, a little tired, remember, you have the power to help keep someone alive. In the end, it all comes down to endurance. This isn't a sprint, it's a marathon. And every step, every compression, every breath you give brings you closer to the finish line. Keep going. Your endurance could save a life. Ever played Operation? This is slightly more important. So you found yourself in a situation where someone is unconscious and not breathing. You've called for help, started CPR, and now it's time to bring out the big guns. Enter the Automated External Defibrillator, or AED for short. This nifty little gadget can be a lifesaver literally, but only if used correctly, so let's dive into how to use an AED. Don't let the term Automated External Defibrillator intimidate you. It's a fancy way of saying a device that can shock a heart back into a normal rhythm. And the best part, it's designed for people who aren't medical professionals like you and me. The first step to using an AED is to turn it on. This might seem obvious, but in a high-stress situation, it's easy to forget even the simplest of steps. Usually there's a big green on button, so press that and you're off to the races. Once you've turned the AED on, it's time to attach the pads. These pads are how the AED delivers a shock to the heart. They come in a pair and are usually labeled or color-coded. One pad goes on the right side of the chest, just below the collarbone. The other goes on the left side, just below the armpit. The AED will then start to analyze the heart's rhythm. This is where the automated part comes in. The AED is smart. It knows what a normal heart rhythm should look like, and if it detects something abnormal, it will recommend a shock. Now here's a crucial step. Before the AED delivers a shock, you need to clear the area. That means everyone needs to be clear of the person, including you. You wouldn't want to get a shock yourself, would you? So shout out a clear, stand clear, and make sure nobody is touching the person. Once everyone is clear, the AED will deliver the shock. It's important to note that the AED won't shock someone who doesn't need it. It's designed to only recommend a shock if it's necessary. After the shock, the AED will analyze the heart rhythm again. If another shock is needed, it will let you know. If not, it will instruct you to continue with CPR until medical help arrives. Remember, using an AED can significantly increase the chances of survival for someone in cardiac arrest. It's a powerful tool, but only if used correctly. So don't be afraid of it. Embrace it. Learn how to use it, because you never know when you might need to. The AED, your high-tech ally in saving lives. Let's review, shall we? The process of CPR, or cardiopulmonary resuscitation, is a lifesaver in the most literal sense. It's a sequence of steps that could mean the difference between life and death in emergency situations. So let's break it down. First things first. If you encounter someone who's collapsed, you need to assess the situation. Is the person conscious or unconscious? Are they breathing normally? These are critical questions to answer before you leap into action. Once you've determined that the person is unresponsive and not breathing normally, it's time to call for help. In the UK, the emergency number is 999. Remember, it's crucial to act quickly. Now let's talk about chest compressions. Position your hands one on top of the other in the middle of the person's chest and push hard and fast. We're talking about at least 100 compressions per minute. It's a bit like performing a bass solo on a human drum, but remember, you're doing this to keep the blood flowing. Next, we have rescue breaths. Tilt the person's head back slightly to open the airway, pinch their nose shut, and give 2 breaths into their mouth. Think of it as a very personal rendition of huff and puff and blow the house down. Then there's the bit about using an automated external defibrillator, or AED. This device can deliver a shock to the heart, which might just bring it back to its rhythmic dance. Don't worry, the AED will guide you through the process with voice prompts. And finally, the golden rule of CPR. Don't stop until help arrives. Keep those compressions and breaths going. It's a marathon, not a sprint. Remember, knowing CPR is not just about ticking a box in your life skills checklist. It's about being prepared to step up when someone's life hangs in the balance. And there you have it. You're ready to save a life.